In Taraba, the state government has allocated 22.6% of its revised 2020 budget to combat the COVID-19 pandemic. Briefing newsmen on the breakdown of the reviewed budget, the Commissioner for Budget and Planning, Solomon Elijah, says the total budget now amounts to 176.6 billion naira. Owolabi Atenusi files in this report.
Taraba State now has 4 cases of COVID-19 related death and 13 active cases. Government on its part is leaving no stone unturned in the ongoing fight against the pandemic. The pandemic, which has affected the global economy, has also forced many states to adjust their expenditures. Taraba State is no exception, and the state government was left with no other option than to reduce the 2020 budget from 215 billion naira to 176 billion naira. Out of this amount, 22 billion naira has been earmarked for COVID-19.
The amount is now trimmed down to 176 billion 616 million 318,475 naira 0 kobo in response to COVID-19 pandemic.
The State Commissioner of Finance explained that while no amount was estimated in the national budget to support states in the fight against COVID-19, but Taraba State has already received 2.3 billion naira from the federal government. Residents appreciate proactive steps taken by the government, but express fear that despite all this effort, the state has still recorded its first death from the coronavirus.
Scary. It's fear. In fact, there's fear in the land already over the news since they broke up the news yesterday. And for some of us who have been following the COVID-19 trend in the state, we saw it coming. In fact, in most of our meetings with the COVID-19 action committee, we always tell them we don't see people observing the protocol in the state.
Most cases, residents of states, particularly on the issue of COVID-19, people are undermining or underrating the spread of the disease.
Social distancing, wearing a mask, hand washing, and people even common things like handshake. Some people refuse to accept that. They will avoid it now.
Taraba State has so far recorded 72 cases, with 55 discharged and 13 currently receiving treatment. The state has 5 isolation centers in which patients are treated freely.